Hi there, this is Dr. Saravana Kumar. In the next 30 to 40 minutes, we will go through how to read a CT scan, especially a CT brain, in an emergency department. We emergency physicians, we have to do repeated CT scans or regular CT scans for many diseases. The most commonly done CT is the CT brain, and clearly we need to have some basic understanding on how to read a CT scan. Similar to an X-ray or for that matter an ECG, we should develop confidence on reading a CT brain and also report any basic abnormalities. Of course, we are not trying to replace a radiologist here, but what we are trying to learn is some of those basic anatomical regions of the brain and how they appear on a scan and what we should not miss out for. So let's have a look at how do we read a CT scan. How do you define a CT scan first? It's nothing but a set of X-rays passed through a computer system where it generates a CT image. In simple terms, it's similar to our X-rays but only with a higher degree of radiation and also processed through a computer system. I'm sure most of us have seen a CT room, right? Usually it has two components in a CT. There is a table, there is a gantry. Why this is interesting or important for us to understand is if you would have noticed a patient undergoing a CT scan, especially CT brain, just imagine or just think for a second how it looks like. You have a patient lying on a bed, you have a big gantry, and this table actually takes the patient inside, and as we do the scan, the table is slowly brought outside. In simple terms, the scan is done from below upwards. This point is very important for us to remember, because when you read a CT scan, you need to understand you are actually going to see the parts of the brain in the reverse direction, not from top to down but bottom upwards. This is an important point for us to learn. So as you can see in the screen, this is how a typical CT film is going to look like when it is given to us to read. But where do you begin that from? And how do we interpret the different parts in the brain and also the abnormalities? So what we will do in the next few minutes is go through this slide by slide to see what each of those figures or the slides actually mean when you read a CT. But for that, what's important is for us to understand the actual anatomy of the brain itself. So let me come to the first slice in a CT. As you can see in the picture here, it shows multiple lines, and some of them are slightly wider and some are slightly narrower. What it basically signifies is the sections or the thickness of a slice. This is good to know to understand which area of the brain or which part of the brain is of particular interest or focus in a particular CT scan. So basically these are called Z-axis. They signify the thickness of the slice. As you can see in the picture now, this is typically how a spiral CT works. It's like peeling an onion, if you imagine, where the scan is continuous and the images between two sections are constructed by the computer itself. These are some basic understandings of how a CT mechanism works. So let's come to the anatomy of the brain. Broadly speaking, we know you have the cerebrum, cerebellum, brainstem as the core parts of the brain. So if you remember, I told you that when you do a CT scan of the brain, the scan is done below upwards. That means you're going to actually see the brainstem first. So now what are the parts of a brainstem? We all know the brainstem has three components: the midbrain, the pons and medulla. This is the parts of the brainstem. So when I say the CT scan is going to show the brainstem first because it's going to go from below upwards, what do you think will be the first image in a CT scan? I know the brainstem is midbrain, pons, medulla, but when you do in a reverse imaging, the first slice in a CT scan is also going to, it's actually going to start from the medulla, followed by pons and followed by midbrain. So how are they going to look like in a CT scan, right? So let's look at those images here. So in the first image here, as you can see in the screen, you can see the center part which signifies medulla. But how do I know this is medulla, or how do I say this is medulla, or how do I identify medulla and pons? The key to identify medulla is actually to identify the image of a pons first. So how do I identify image of a pons? Let's go back into the anatomy of the brainstem itself. I am showing you a closer picture. As you can see in my screen, what you are seeing in the screen is actually the brainstem, your cerebellum's removed, and if you view the brain from the posterior aspect, this is exactly how it looks like. Pay close attention to where I am showing in the arrow mark. You can see these two broad structures. These are called peduncles, and you can see it's clearly marked as middle cerebellar peduncles. There are three peduncles: superior, middle and inferior cerebellar peduncles. Among them, the middle cerebellar peduncles are broad and thick. As you can show as I move my arrow, this is the middle cerebellar peduncle. You can see it's kind of like an horseshoe shaped as well, if you notice it. So what is the significance of this middle cerebellar peduncle? The pons connects to the brainstem through the middle cerebellar peduncles. So remember this point. The pons is attached to the cerebellum or the brainstem area through this middle cerebellar peduncles. This middle cerebellar peduncles typically looks like an horseshoe shaped structure in the anatomy. Let's come back to the slide here and look at this picture. Just pay close attention. Just follow through the arrow mark which I am trying to show. Can you see this image which kind of looks like a tooth and enamel, where you can see there are two structures here in the bottom, right? There is a brainstem here and there are two structures here which looks like or resembles horseshoe. So this particular image is nothing but of your middle cerebellar peduncles. What you are seeing here as this horseshoe image is what you are seeing here in this image as the middle cerebellar peduncles. So obviously you know the part of the brain which is connected through the middle cerebellar peduncle is pons. So you know if you see an image like this which kind of resembles like say a tooth and an enamel, is nothing but your pons connected to the brainstem and cerebellum through your middle cerebellar peduncles. That's the structure which you see, which is quite easy to identify in a CT scan. So once you identify pons, it becomes much easier for you to identify the rest of the structures. I am going to show an enlarged image of the same. As you can see in the screen, this is an image of a CT slice where you can see there is middle cerebellar peduncles, there is pons, there is cerebellum. So this is an image of a pons. So assuming you get a CT scan like this, I am showing you an entire film. As you can see in the screen, it has got the first slice which I told you is basically the thickness of each of those slices. Just scroll through to see if you are able to identify pons. How do you identify pons? I just mentioned, identify the middle cerebellar peduncles or the tooth-shaped structure. Let's quickly scroll through. Do I see a structure like that which I just mentioned here? Doesn't look like it. Here, doesn't look like it. Here, beginning to look like it. So looks like there are two areas of middle cerebellar peduncles I am seeing here. And when I come to the next slice, it's quite clear. I can clearly see a middle cerebellar peduncle. So that means the image which I am seeing here is pons. This is also probably pons. But when I go to the next image, I can clearly see there is no tooth-shaped structure or a middle cerebellar peduncle. So that means we have come above pons. So now it's quite easy for us to understand. You have identified pons. So this slice is of pons. If this slice is of pons, what do you think is going to be before pons in a CT scan? I told you the scan is going to be below upwards. So what do you think this two structures here, the one in the middle here, and which part of the brainstem is this? Yes, it is medulla. So you're starting with medulla. You have medulla. As you can see in the screen, this image shows pons, and as you go up, you go to the midbrain structure. As such, you can see the midbrain in the center. So this is how you identify the brain stems in a CT image. As you can see, the first 5 or 6 slices, depends on how thick is going to be your slice, is going to cover your brain stem. You remember 3 parts of the brain stem, which is midbrain, pons, medulla. As the scan is done below upwards, you are going to start with medulla, followed by pons, followed by midbrain. The key to identify the parts of the brain stem in a CT scan is actually to identify pons. How do we identify pons? Remember those middle cerebral peduncle structures? They look like a horseshoe. In other simple terms, you can remember it like how a teeth and an enamel is going to look like. Search for that structure in the CT films. You will usually see it after 3 or 4 images, and once you identify that, you can clearly understand that's pons, and any image before that is actually your medulla. Anything after that is going to be your midbrain. So that's easily how you identify midbrain, pons and medulla, right. So coming to the structures which are above them. Once you have passed through the brain stem, you can look at the image which I am showing here in the screen. Just pay close attention. So what is this image? It's the same picture which I showed some time back. This is an actual anatomical slice of that image. This constitutes your brain stem. You can see the middle cerebral peduncles which are kind of sliced in this image. So you got a brain stem, you have medulla, you have pons which are attached through this peduncles, and you have a midbrain here. Just have a look above the midbrain. What do we have anatomically above the midbrain? You have corpora quadrigemina or quadrigeminal cistern. As you go up, you actually see a third ventricle like a slit-like structure in the center. Right next to the third ventricle or medial to your third ventricle are your thalamus. Right next to your thalamus, you have an internal capsule. As you can see in this image, all you have to do is just remember this image whenever you read an CT brain. This image is very, very important because this will help you identify the structures in the CT. Look at it clearly. You have above brain stem, you have quadrigeminal cistern, you have third ventricle. Medial to the third ventricle, you got thalamus on both sides, and right next to the thalamus there is a bat wing shaped structure, right. Now pay close attention to the image which I am showing on the screen. Look at it and try to make correlation between these two images which I am showing in the screen. It's very obvious. You got a central slit-like structure. What do you think it is? If you just compare with this image here, clearly that's your third ventricle. Very easy to identify third ventricle. And right medial to the third ventricle, what do we have here? Right medial to the third ventricle, we have thalamus. So where does it appear? There. This is your thalamus in the screen. If you just pay close attention to the screen, you have third ventricle, you have thalamus on both sides. Okay. So what is further away from thalamus? There are two wing shaped structures. These are your internal capsule. Where do they appear? Pay close attention here. Can you see this image here? The particular area where I am scrolling my mouse, this is your wing shaped structure right next to the thalamus, and that's your internal capsule. So this particular image of a CT scan actually shows your third ventricle, your pons right next to it, and then you have an internal capsule slightly right next to it. Quite easy to identify these structures, isn't it? Right? So here is a quick example for you. So this is an abnormal CT. You got some bleeding in one of those areas of the brain. Can you imagine or can you guess which area of the brain is involved now? I said this is the third ventricle. This is the internal capsule. Clearly you can see there is a bleeding around thalamic region. So you can confidently say there is a bleeding around the right thalamic region in this image. Right? I am just trying to show an example image. It's an acute, hyperacute bleed. Right? So what's the main point to remember? This anatomical structure. This is something which you need to keep in mind. There is a brain stem, starts from medulla, then comes pons. It has middle cerebral peduncles, looks like horseshoe shaped structure. That will look like a horseshoe shaped structure in the CT scan image itself. Once you identify pons, you know where is medulla, where is midbrain. Above midbrain comes corpora quadrigemina or quadrigeminal cistern, but we didn't cover quadrigeminal cistern yet. We actually went past above it. So let's see what or how a quadrigeminal cistern looks like. Look at this image right next to the picture which I have shown. Just focus on this image. Doesn't it look like a smiley to you? Like it has got two eyes and a nose shaped structure and a simple smile. This is nothing but your quadrigeminal cistern, or the other name for this is actually smiling cistern. As you can clearly see, there are two eyes. This is your third ventricle and this is your smiling cistern or quadrigeminal cistern. So over this, what is going to come? We just showed you in a slide previously. Over the structure you have clearly thalamus, internal capsule, right? Very clear. So please make sure you remember this one particular image whenever you read a CT scan, right? Whenever you read a CT scan, always think about this basic anatomical structure so that you can spot the particular area in a CT scan. Okay, let's move further. So we have shown you brainstem, we have shown you third ventricle, the thalamus, the internal capsule. But what lies right next to the internal capsule is called your lentiform nucleus, the basal ganglia, right? It has got a head and a body. So the lentiform nucleus, the head, if you can see in this picture very clearly, when you slice the head, it kind of looks like a biconvex shaped structure. Look at the image here which I am trying to show. So what is this image? This is your third ventricle, this is your thalamus right next to it, and you have this, say, a wing shaped structure which is nothing but your internal capsule. Right next to your internal capsule you see two bright structures both sides. So look at this one where I am showing my arrow mark. This is a biconvex structure, a lens shaped structure, right? Look at it. This image shows it even more clearly. Third ventricle, thalamus, a wing shaped structure which is internal capsule, and right next to it you have a lens shaped bright structure which is nothing but your lentiform nucleus or basal ganglia, right, or head of basal ganglia. So in this one image you actually see thalamus, internal capsule and lentiform nucleus, right? Very easy to identify in a CT scan. So as you pass through, you are going to come into the cerebrum proper, right? Here you can see the thalamus, you can see internal capsule, lentiform nucleus. As we go up, you actually look at choroid plexus, that's where your CSF basically gets produced. So you have posterior horn of third ventricle. So these are your ventricles over the brain, right, which are quite easy to identify. I am sure most of you know how it's going to look like. So let's all come back and put it all together. Pay a closer look in the image which I am showing to you now. This is a CT scan image, an actual CT image which you are going to get in any patient. So let's start from the first slide. So remember, what is the first one? It basically talks about the thickness of the slice, right? The axis, the thickness of each of those slices. Once you move from that, the first image is going to be your brainstem. The key to identify brainstem is identify pons. Where is pons here? Probably the number 4 and number 5 here, because that's where I could see a middle cerebellar peduncle. So this is pons in the center, this is pons in the center. So that means this is my medulla, cerebellum, cerebellum here, and here you can see pons, middle cerebellar peduncles, cerebellum, pons, middle cerebellar peduncles, cerebellum. As I move to the next slide, I can clearly see we have come above the pons, which is your midbrain. You can see a heart shaped structure in the center, the heart shaped structure, this is your midbrain. And remember our anatomical structure, I just showed you some time back. Above midbrain is your quadrigeminal cistern. Pay close attention to these two images. You can see a smile, a beautiful smiley image. It's nothing but your quadrigeminal cistern or smiling cistern. So the nose is actually nothing but your third ventricle. As we go to the next image, you can clearly see here. Can you assume what it is above your quadrigeminal cistern? It's clearly your area of thalamus, third ventricle and internal capsule. Have a look at it closely in the image I am showing you. You got third ventricle, you got thalamus right next to it. You got a wing shaped structure here which is nothing but your internal capsule. So what lies outside the internal capsule? You have your basal ganglia or the lentiform nucleus. Here you can see the internal capsule clearly. Even in this image you can see internal capsule, and you can see a lens shaped structure, a biconvex structure which is quite bright outside your internal capsule. This is nothing but your lentiform nucleus, right? And as you go into the brain proper, you will actually see the lateral ventricles, the posterior horn of lateral ventricles. You can actually see choroid plexus, these two white structures here, cerebrum, cerebrum, body of lateral ventricle, cerebrum, cerebrum. Very easy to identify the parts if you remember the anatomy. So let's quickly revise. You have the thickness of the slice, got medulla, medulla, pons, pons, midbrain, quadrigeminal cistern or smiling cisterns here. You could see third ventricle, you could see internal capsule, you could see thalamus, you could see lentiform nucleus, you could see the actual ventricles, lateral ventricle, the body of lateral ventricle, choroid plexus and cerebrum proper. Very easy, isn't it? So, apart from the anatomical region, we should also understand the basic blood supply of the brain. As you can see, the anterior circulation is by common carotid artery and it branches into anterior cerebral artery and middle cerebral artery. The posterior circulation is by vertebral arteries and through posterior cerebral artery. So, look at the image here, very simple and clear image. The anterior part of the brain, it's basically an image of a cerebrum. The anterior part of the brain is by anterior cerebral artery, the middle part is by middle cerebral artery and the posterior part is by posterior cerebral artery. Hope you could follow my arrow mark here. This is middle cerebral territory, anterior cerebral, anterior arterial territory, middle territory and posterior territory. So, look at this, this is an abnormal image. There is some sort of an abnormality here. This is an infarction, but clearly which area is involved? It's clearly the middle cerebral artery is involved. So, typically this is an image of a middle cerebral artery infarct. We are not going into the abnormalities in this particular topic, but clearly this is to show the various regions of the brain, right. So, you want to try with me once again on how to go through these images. Your first image is your slice thickness. What do you think this is? Medulla. This one is medulla. You got the peduncles which are middle cerebellar peduncles, pons, pons, middle cerebellar peduncles, midbrain, quadrigeminal cistern, internal capsule and thalamus, lentiform nucleus, lateral ventricle, choroid plexus, body of lateral ventricle, cerebrum proper. Within 30 to 40 seconds, you can actually identify different structures, and if there are any particular abnormalities in any particular area, you can very easily identify. I am going to show you a couple of abnormal slides here just for the understanding's sake. As you can see in these two images, this is a couple of bleed. One is an extradural hemorrhage outside the dura because it's biconvex shaped, limited by dura, looks like a lens shaped, isn't it? The other one is a SDH, subdural hemorrhage, under the dura, and any bleeding under the dura is going to cross your suture lines. So, it's going to look like a crescent shaped, right? What part of the brain is this? You can guess. It looks like a heart. So, which part of the brain looks like a heart in the brainstem? This is your midbrain, and you can see there is a bleeding around the ventricles of the midbrain. This is actually subarachnoid hemorrhage, right? You can see bleeding in the posterior aspect as well. So, here is another abnormal image where you can see in the cerebrum proper there is some contusion. In fact, there are two small bleedings here. These are nothing but two EDHs because these are limited by suture lines. Which artery is involved, you think? You can see there is an abnormality in this particular side. This is in the area of infarct, and this is the area of middle cerebral artery infarct. So, with this we conclude this topic, and I hope you find it easier to first identify the anatomical regions of the brain in the CT scan, and then you can look into the abnormality and which location it is. Thank you all very much.